will be from Suzanne Daub, who's a health consultant for the National Council for Behavioral Health. Her presentation is entitled When We Look Away, Primary Care and Serious Mental Illness. Please welcome to the stage, Suzanne Daub.
It's a privilege to speak to everyone on tonight, October 10th, Mental Health Awareness Day. So my story starts 20 years ago when I took a job at an FQHC as the director of social work. And what I saw there blew my mind. Here's the thing, 20 years ago, I assumed that if you had a mental health problem, you went to see a therapist. At the health center, I met Ed, whose diabetes was out of control, and who asked me, why would I go see a therapist? I just caught a little depression. And I was like, really? And he said, absolutely. Ed walked around with dangerously high blood pressure, and his PCP didn't touch his depression. I met Ori, whose depression was so severe that she could barely make it out of bed. Ori found alcohol and Percocet far more effective than antidepressants. You know, I just found the level of mental illness presenting in primary care, for me, unexpected and shocking. And I could see the PCPs really struggling. These people take up way too much time. I'm not trained to deal with this type of problem. You know, and I found CFHA, and I learned how to provide collaborative care. And this changed how I practiced ever since, and has been the most important work I've done in my life. Last year, after 18 years with that same FQHC, I joined the staff of the National Council for Behavioral Health. There I was, about a week into the job, and I learned this astounding statistic. It turns out that people with serious mental illness die 25 years earlier than those without one. I was so ashamed that this information was new to me. All year, basically, I've been asking myself, are we failing to manage the physical health of the mentally ill in community-based primary care? I want to invite you to think this through with me. In 2011, the WHO listed overall health in the United States, overall life expectancy, at about 79. Cut 25 years off of that, and you're looking at about 54. The last time folks were dying in 54 was in 1913. That's crazy ridiculous. I mean, from a public health perspective, 1913 was horrible. No readily available clean drinking water, no vaccines for diphtheria, pertussis, tuberculosis, flu, no antibiotics. But 100 years later, that's not why the mentally ill are dying 25 years early. Suicide is a big factor, accounting for 30 to 40% of early deaths. But it turns out 60 to 70% die of, get this, preventable and treatable medical conditions such as smoking, obesity, substance abuse, and inadequate access to medical care. Now, folks with SMI will tell you straight out they just don't feel welcomed in primary care. Last week, I saw a BHC approach a provider on treating a sleep problem, and the PCP's response was, that's psych, I'm not dealing with it. I've heard BHCs plead, she's psychotic. Her mental health center closed down. She just needs enough meds till she gets linked up. And the PCP was like, syndrome of crisis. I don't prescribe those meds. And out she went. And it's not just the PCPs, right? You know, the PHC wasn't thrilled to have this very symptomatic individual showing up at the health center. He was unnerved by the psychosis and annoyed with the community mental health center pushing the patient off onto primary care. Am I alone in hearing these struggles? No. So here's what I think happens. In these situations, we get triggered by the mental illness and the mental health issues, and we miss the opportunity to address the broader discussion with the patient of their overall health. And you know, all the patient hears is, get out of my exam room. We talk a lot about how primary care providers are punished if they take longer than 15 minutes with their patients. This pushes us to provide very rigid, algorithmic care, and serious mental illness does not fit neatly into an algorithm. It demands relationship-based healing, but it's deeper than lack of time, and it's deeper than lack of training. Frankly, I think that we are all uncomfortable with the symptoms of serious mental illness, and this leads then to avoidance. So we've gone so far as to create a whole nother model of integration, reverse integration. Certainly reverse integration is the right model for some folks, but what about all the folks with mental illness out there who are not linked with the mental health system? I want you to think about this. Does community-based primary care have a responsibility to address the needs of the seriously mentally ill? And consider this. How can we possibly address this huge health disparity if the leading affected population isn't part of the conversation? I think we need to start first by acknowledging our own discomfort and learn then how to intervene effectively with people with serious mental illness toward improving their health. I still believe collaborative care is the best and most logical solution for improved health for this population. But we need a shared commitment to this goal, and we are not there yet. We need willingness and leadership from the mental health folks, the policy folks, the public health folks, the medical folks. People with serious mental illness can live longer, and we can have and take this rare opportunity to be part of this tipping point. So are you on board with me? Because we need leadership from the folks at this conference. And let's return to that essential question. Does community-based primary care have a responsibility to address the physical health needs of the serious mentally ill?